Good afternoon, everyone, and welcome to today's press conference for Friday, the 5th of February, and it's just after 3. Thank you very much, as always, for attending. Today, we have on the panel, we have Lucy Whiteman, we have Eileen Doyle, Chris Pallow, and Elliot Foskett. We're also joined by Paul Andrews from the school cell, Katie Brown, who's the Acting Director of Adult Social Care, Councillor Nunn and Councillor Tom Beattie. What we'll do is the usual format where we go through, where everyone gets a chance to speak first, and then once they're done, we will go to the questions that you have kindly submitted ahead of time. We've got quite a number of questions today, so unless there's suddenly a big area of time left at the end, we're going to just stick with those written questions today, because I think there's some really good questions there and we want to make sure we have a chance to answer them in full. So without further ado, we'll go to Lucy Whiteman, the Director of Public Health, for her update on the key messages and latest surveillance report. Thank you, Lucy. Good afternoon.
Good afternoon. Thank you, Councillor Morris, and good afternoon. Thank you for joining us once more. So as usual, we've got the surveillance report to share with you. So if we just bring that up on screen. Super. Lovely. If we can just get that into sort of slideshow mode. Wonderful. So key headlines. Obviously, everybody very aware that we continue to be in national lockdown and therefore the restrictions continue to be in place. And, you know, one of the reasons that it's clear that this is still required is very much apparent in Northamptonshire. We've seen a really good recovery in most areas geographically, but recovery is slower in some areas, and Corby is a very prime example of that. Currently, it's got the third highest case rates in the country. Now, that's not to say that the overall case rate isn't coming down. It is, but the recovery is much, much slower, and it is very, very fluctuating on a day-to-day basis from a point of view of a reduction in positivity and case rates. So that we've still got a lot more work to do, and we've still clearly got to make sure that those messages are getting through to everybody around compliance, and that this is the way forward to get us out of restrictions and get us back into some sense of normality. Now, one of the things that we have heard is that, you know, people obviously are starting to get their first vaccination, but that does not mean that they are not still required to be self-isolating, living within restrictions. They should not be mixing between households, and they certainly shouldn't be meeting with other people of those older and more vulnerable groups. Even after we've had both of our vaccinations, everybody still has to adhere to the rules. They should not be mixing between households. They should not be going out for anything other than essential work and essential food shopping and such like. And similarly, for those people that are accessing testing, particularly the new lateral flow device testing, even a negative result does not mean that you do not have COVID, and you are still required to work within the current restrictions. We are finding that we'll be having reports of deviations from the legislation in both of these groups, and it's really, really concerning. And that is why we still do have, you know, well over 2,000 cases in the last 7 days up to the 31st of January in Northamptonshire. That is still a high rate, and it is still higher than the England average and the East Midlands average as a county. So we do need to make sure that people are continuing to adhere, because despite lockdown, we are still finding that the primary cause of onward transmission of COVID continues to be household mixing, so within households, but also household to household transmission. So people still not sticking to the rules. If we go on to the first data page, please. So you can see here, you know, this is the pattern, and you can see a very steep increase and a much more gradual decrease in numbers. And as I said, still 2,402 cases in the 7 days up to 31st of January. So still cause for concern, although one of the things that is clear is that lockdown, where people are complying, is working. And that's why we have got to continue to be resilient, to stick together, to do the right thing, and to continue to reduce our interaction with other people wherever possible, to make sure that we continue to break any onward chain of infection. Next slide, please. So here obviously is the clear evidence of why we've still got some challenges. So Northamptonshire as a county compared to England still statistically significantly higher, and that is a real concern. You know, yes, it's being skewed by particular rates in particular areas, but overall we've got a county that is still at increased risk as compared to most other areas of the country. In Corby, you can see there that significantly higher rate per 100,000 population as compared to the Northamptonshire rate, so 501 as compared to 339. And again, Northampton, much better news, a much faster recovery than Corby, but because of its population density, levels of deprivation, etc., again, we've still got a higher rate than we would want, but the progress in Northampton has been markedly improved. Wellingborough, an area that is of slight concern, so that although similar to the county rate, is now starting to flag as slightly higher than the England rate as well. So one area that we've seen an increase in the last 7 days that we will be keeping a very close eye on. We go to the next slide. So here's the absolute number of cases by borough and district, and you can see it is good news. We are generally decreasing, but it's the rate that is the concern, and that means that all other areas are getting to a point where they've got a much faster decrease in case rates, much faster decrease in positivity, and that's why Corby's being left behind in particular. It is, as I said, at this point in time, the area with the third highest case rate per 100,000 population in the country, not because it started really high or much higher than other areas, but because its recovery has been much slower than other areas. Overall, travelling in the right direction, but we've got to pick up pace. If we move down. And this really just actually demonstrates that. So we've talked about this before. I think it was presented for the first time last week. So this is the percentage change in case rates week by week. So those above the line across the middle shows that we've got an increasing number of cases, and it shows that increase as a percentage compared to the previous 7 days. As we can see from middle of January, we've got day by day, you know, a decrease in the number of cases, but you can see that the rate of that decrease is now starting to slow again. And we've got to make sure that we are getting people tested, that we're identifying where we've got positives and getting people to self-isolate so that we can make sure that that decrease, the rate of decrease, actually speeds up. If we go down to the next slide. So here's a really good illustration. You can see there Corby really sort of flatlining from a point of view of its weekly laboratory confirmed cases. So all other areas slowly but surely coming down, but there, you know, Corby certainly flatlining, if not slightly picking up. And one of the areas that it has sadly picked up is the over 60s. And we know that that obviously comes with increased risk of, you know, significant illness and potentially admission and or, you know, a very negative outcome from a point of view of mortality still remains high in Northamptonshire. If we go down to the next slide. Yeah, and there you can see we've got a little bit of an increase in the older age groups, but the bulk of cases are still that younger working age population. So yes, we recognise people do still have to work, many of whom are still working within the current restrictions, but we're just asking people to be, you know, super careful about how and when they are interacting with people outside of their COVID secure work environments. We are still, you know, finding people who are car sharing and not doing it, utilising all of the restrictions wherever possible. Obviously, ideally, they'd be looking for other forms of transport where they can be more spaced out, making sure that you minimise the number of different people that provide you with childcare, for example, for those that are having to work. We do recognise that these are all challenges that we're having to face and they're difficult to navigate under the circumstances. But if you do want advice, if you are concerned about the level of risk around the things that you're doing that you have to do and that are within the current restrictions, please do seek advice and support from the public health team or your environmental health teams. They're there to help and help you mitigate the risk where it does continue to exist. But that working age population is still a big concern. We do still need to make sure that people are being you know, as good as they should and need to be in order to get ourselves into a more positive position. Next slide, please. So this is overall, again, another good news story. So cases in the over 60s coming down, but again, you can see that red line in Corby, that slight kick up in the last couple of days coming towards the end of January. And again, as I said before, that's a real concern. We've only just started to get on top of case rates that are ending up as admissions. We really can't afford to be losing that additional capacity that we're starting to get back in our primary and secondary care services. Next slide. And as you can see, yes, again, good news story overall. Case numbers in hospitals starting to come down. We're really, really grateful for that. And we do recognise how hard everybody is working in the most part to sort of improve on our position. What we have to remember, though, is despite this looking like a much better picture, we still, at this point in time, have more COVID positive cases in our hospitals than we had at the peak of the first wave in the spring. So although it is a really good news story, we are by far away from a point where we've got the capacity we need back in our system to be managing all of the normal winter demands, but also to try and catch up with some of those planned interventions, planned operations that have all had to be put on hold at this point in time. If we go on, please. And again, a good news story, but still not as fast a progress as we would want to see. So the number of deaths, really good news, starting to come down, but we've still seen nearly 50 people lose their lives to COVID in the 7 days up to the 31st of January. And again, you can see where those cases are. They really are across all boroughs and districts. Nowhere is immune from this. And those are families who are obviously having to deal with things that they would never have to want to. And absolutely, still, this is preventable. People have got to take responsibility for their actions and recognise that if they're not sticking to the rules, if they're deviating at all, this is the potential outcome. If we move on again. So again, we always provide cases by rate and by crude number in all of our areas. Again, you can see nearly the whole of the top 20 there being in Northampton and Corby, only one or two exceptions. So these continue to be our most deprived, our most densely populated and our most at risk areas. If we skip the next one and go to the third, I just want to sort of highlight, this is one that we usually skip over, but these are the areas. So broadly, we've got good news, as I said, that most areas are starting to come down in their case rates, but you can see that there's actually 3 areas that have got increases in their case rates, all in Wellingborough. So again, it's one of the areas that we need to be focusing on if we aren't to see a slowing in the position as we have done in Corby. So, nowhere is immune from this. We have to keep on keeping on, doing all the right things. If we go to the next slide, please. So outbreaks are thankfully still at a manageable level, and you will see obviously the primary outbreaks continue to be in the home care and sort of care home provision area. They are, as I said, really complex. You can see again the number of cases associated with the number of outbreaks. So these are bigger outbreaks, as they tend to be because of the higher infectivity rate with this new variant. However, the one thing to point out that Corby has not significantly increased in the number of outbreaks, and nor have the outbreaks in workplaces particularly increased in the last couple of weeks. So again, the environments are secure. It is people's behaviours in and around the workplace and or when they are at home that is the issue here and the reason for the continued spread. So if I stop there, Councillor Morris, and then we can move on into questions later.
Thank you very much, Lucy, as always. A very good summary of the situation we find ourselves in. No time for complacency, I think, would be the summing up of the message, we all would agree with you on that. I'm going to come now to Eileen Doyle, who's Chief Executive Officer for Kettering General Hospital. Good afternoon, Eileen. Thank you for joining us as always.
Thanks, Councillor Morris, and hello, everybody. So another busy week in our hospitals, both Northampton General and Kettering General. As Lucy has talked about, we're pleased to say that the numbers of inpatients are coming down. We have 246 inpatients between us today. That's a decrease from last week, which sat at 396, so a really good reduction. But as Lucy said, we can't be complacent because it will very easily go back up again if we're not careful. And also that number today was our peak number, in fact, a little bit higher than our peak number the first time round. So things have improved, but we don't want to normalise the ever increasing numbers if we can possibly help it. That said, intensive cares, both of them remain really busy. And in fact, the numbers have gone up since last week. So we have 29 COVID positive patients between the two hospitals today, receiving the highest level of support in our intensive care units. So whereas we've got an improving picture for our inpatients, actually the sickest are growing in numbers, and so therefore we really have to concentrate on making sure that we're doing everything we can, as Lucy has said. We still, our staff absence has improved, so we've got 3.7% of our 10,000 staff, so thereabouts 386 people off with COVID or COVID-like symptoms or isolating, and every one of those members of staff we could do with having back. So most of our staff live in the community. If it's out there in the community, our staff are just as likely to potentially contract this virus. And as Lucy said, you know, the numbers of deaths are too high. And remarkably high, actually. And although it is winter, and we always, we often see a higher number of deaths, sadly, in winter, it's high. And I would say that really does not only affect loved ones, families, but it also affects our staff who are having to deal with this day in and day out. So I'd really like to pay tribute to everybody that's working in health and social care, really, for the tremendous efforts that they're putting in quite difficult circumstances. Obviously, with an improving picture, and I know that obviously having been on this call before, I've talked about services that have moved around in order to make sure that we had enough capacity, particularly at Kettering. I'm pleased to say that because the numbers are decreasing, there is no further need to do any of that, those kind of that planning currently. And in fact, what we will try and do over the next few weeks, should the trend continue, is to try and bring work back onto both Kettering and Northampton General, and both hospitals have continued to book urgent and emergency surgery and cancer surgery. That's continued, but as we've talked about before, that's always at risk if the numbers get out of control and actually we can't accommodate those patients. And we're using our partners in the independent sector, in the private hospitals, to get some of that work through, and also some of our less urgent work but needs doing nevertheless. So an improving picture, but we really do need to be vigilant, because we have been here before, and I think if we'll recall, after the last mini lockdown in around November, actually our numbers didn't come down sufficiently for us to have a good standing start ready for this really big wave that's hit us recently. So grateful to all our staff, grateful to the public for doing everything they can, but there is more to be done, because it is us that's spreading it, and so therefore we've always got to bear that in mind. So thanks, Councillor Morris.
Thank you, Eileen, as always, and some sobering thoughts there. And we must all pay attention to the numbers of people who have died, most importantly. And what we don't want is a third wave of any description, which could happen if it got out into the community and started raging away again. And that would be a disaster, given where we are with vaccination and things like that. So it's just more of the same. We have to keep going. And talking of vaccination, I want to bring in Chris Pallow now, who is the Programme Director of the COVID-19 vaccination, doing a very important job for us in the county. Chris, good afternoon. Thank you for coming, as always.
Thank you very much, Councillor Morris, and good afternoon, everybody. So in terms of the vaccination programme this week, some of the key headlines for us are that on Tuesday we managed to hit the maximum daily throughput for the vaccination centre for the first time, which was 1,450 patients who were vaccinated, which was wonderful news for us, and more importantly for the patients. We continue to work very closely with our colleagues in primary care, and our key focus for the next 10 days is to complete the vaccination programme, which is to offer vaccinations to everyone who's aged over 70 in Northamptonshire, and also health and care workers and those in care homes, to ensure that those in the JCVI cohorts 1 to 4 have been covered. You will, I'm sure, have seen the figures that have been released, which is that at the time of writing, Northamptonshire had delivered 96,000 first vaccinations to members of the population. We had delivered it to 91% of over 80s, 90% of over 75s, and 30% of over 70s. And whilst I can't release the figures, we have made very considerable progress, particularly in the over 70s and the over 75s since the time of writing, and the overarching numbers that we've delivered are increasing. The key message I'd like to give is in relation to the age cohorts. Our colleagues in primary care are working extremely hard to call in patients who are aged over 70 and above in the next 10 days. And those calls are going out from primary care now. And so I would encourage members of our communities to accept those offers when they come through. At the same time, nationally generated letters will also be landing on the doorstep, and probably, in fairness, have already landed for everyone aged 70 and above. So they do have a choice. If their GP calls them, please do accept that offer. But they also have the choice to come to the vaccination centre, and they can book that through the national helpline, and the website will be on their letter. The other changes that have happened this week is that at our hospital hubs, the hospital hubs at Kettering and Northampton are in a really great position because they have been able to offer the vaccine to many thousands of staff in both of those hospitals. And as a result, they have currently paused their operation whilst we're waiting for the dates to come round for the second vaccines to be administered. Staff there, though, if they haven't yet taken up the offer or they wish to have the Oxford vaccine, can also book into the vaccination centre, where we're taking care not only of the over 70s, but also all health and care related staff within that cohort as well. The figures which are released include all of those who have accepted the vaccine offer. Those which have yet to be covered, so if we think of the over 80s, the 9% remaining, we have no way of knowing whether that person has simply declined the offer or is waiting for their appointment to come through. We don't capture why they are still waiting, because we just don't know. The final thing I'd just like to say is with regards to the forecast bad weather over the next few days. We know that on occasions, patients will quite understandably have difficulty in attending appointments. And my plea is that if a member of our community can't make their appointment, then please, that there will be no detriment to them, but please do try and let us know. And I think, Councillor Morris, that's all I'll say at this particular point.
Thank you very much, Chris. Some heartening news there, and indications again of how brilliantly our vaccination programme is going across the county. And thanks go to all the people that have made that possible. It really is wonderful news. Thank you very much, Chris. I'm going to come now to Superintendent Elliot Foskett from Northamptonshire Police, who's keeping us all as safe as he can during this crisis. Elliot, over to you.
Councillor Morris, thank you very much. I'll try my best, and if there's any noise in the background, there's a bit of excitement in the office as we're training a sniffer dog at the moment, and so he's currently mooching around the office as we speak, so bear with me. Just a brief one from me today. Over the past 7 days, Northamptonshire Police have issued 281 fixed penalty notices, so again, you're seeing that high level of enforcement that you've come to expect from us over the past few weeks. The majority of those have been participating in a gathering in a private dwelling, as Lucy was talking about, mixing of households, and that's where we're seeing the bulk of these fixed penalties being issued, because that's where we're getting the reports from. In the last 14 days alone, we've had 1,000 reports into us of breaches, and we've attended just short of 70% of these. And the ones we haven't attended generally have been followed up in slower time in any case, so we are getting around to most of them. We've seen some business reports again that I'll talk about in a little while, but actually the majority of these tend to be around people indoors or mixing in groups. And I've said this week on week, I guess, the message is really clear. It's been really clear from Northamptonshire Police as well as our partners. Just don't do this. It's not safe. It's not safe, and you will be liable to a fine. We are giving them out, as you can see. So as you would expect, the majority of our breach reports centre around our main town areas, places like Northampton, Kettering, Corby, etc. And that's where the bulk of the reports come in, and that's where the bulk of the enforcement is done as well. Remembering, of course, that these are reports rather than just the proactive stuff. We are out and about with the joint enforcement team and with our partners in environmental health and local authorities, districts and boroughs, enforcing and doing proactive patrols as well. So just really following on from the report from Lucy, I think concerns around Corby, it's worth just mentioning for us at this point that we're directing, and we have directed more resources into the Corby area. And I suspect that if you are out in Corby in the next few days, you will see quite an increase in police presence out on the streets. And, you know, we are responding to breach reports as they come in, but we are also doing that proactive stopping of vehicles that I've talked about week in, week out on these calls in the past. So, you know, we'll be stopping people, asking them the purpose for their journey. And if you are undertaking an unnecessary journey and you have not got a a reasonable excuse for being out of the house, because remember, the law is the law at the moment. We are saying to you, you should be at home unless you've got a reasonable excuse. And if you haven't got that reasonable excuse, again, you could expect that you could get a fixed penalty for that and are likely to do so. So I think really the only other thing I've got to say is just in relation to our vehicle traffic on the road. For those of you who are going to work or are out and about, I don't think it will have escaped your attention that the vehicle traffic that's on the road at the moment is not too dissimilar to what we would normally see pre-lockdown, and our vehicle traffic has risen over the past 7 days to just around about 30%. So you can see more people using the roads, more people putting others at risk then, and that increase, I've said it again last week, that increased risk of accidents and collisions, and again ending up in hospital and putting even more strain on the NHS at a time when they really need that capacity. I think that's about it from me, Councillor Morris.
Thank you very much, Elliot, as always. And as with the vaccination programme, I'd like to thank the police for their sterling job they're doing to help keep us safe in the county. And you know, we do find ourselves hitting the high notes in the top 10 list or even top 5 list of enforcement. And I think that is testament to the wonderful people that work at the police force, including yourself, Elliot. So thank you very much. We'll come now to the questions from the media. I've got up first Alison Bagley from the Northamptonshire Telegraph. Alison, are you there? Good afternoon.
Good afternoon. You all right?
Yes, very good. Thanks. You?
Yeah, I mean, Chris did answer one of my questions, but it was about the vaccination centre at KGH. And you said that the KGH and NGH had theirs paused, the vaccination centres there. Why is that? And if you're trying to vaccinate as many people as quickly as possible, why is that happening? And when will it resume? And secondly, members of the army have been deployed at KGH, have been seen on wards. How many members are there? Why are they there? And what roles are they being used in, please? Are they medical or support roles?
Thank you, Alison. I think I'll come to Chris for the first bit on that to do with the vaccination centre.
Okay, so thank you for the question. You're right, I did cover some of it off. So it is entirely planned, is the thing that I'd like to stress. You asked why it was, and that is because the hospital hubs were set up to deliver vaccines to frontline workers. We also vaccinated those over 80 who were already attending outpatient appointments. And at the start, we also offered a vaccine service to some local care homes as well. It's important to stress that the service at Northampton started in the very first wave on the very first day, with Kettering following a number of weeks later and the GPs going live as well. We have virtually completed those cohorts. The last thing that we want to be doing at the moment is to be inviting patients onto the hospital sites when there are alternatives for them to be vaccinated in primary care in the vaccination centre. And you can see the uptake that we're achieving through those other facilities. So there is nothing behind it in terms of why it's being closed. It's part of our plan, and many others around the country are also in the same position. I would also say that it wasn't just first responders which staffed those. There were a lot of them, and we were so grateful to them, but they were also staffed by other volunteers, clinical volunteers from many different organisations. They will reopen to deliver the second doses when they become when they are required at the 12-week period. So hopefully that answers your question.
Thank you very much, Alison, for the question. And Chris, there was something to do with the army at KGH there as well. I'll bring in Eileen to answer that. Eileen, over to you.
Thank you. So yes, we do have 12 members of the armed forces here at KGH and 9 at NGH actually. We were both offered additional support. And as I mentioned earlier, with 3.7% of our staff being off with COVID or COVID-like symptoms, many of those are healthcare workers, admin assistants. And so the military personnel we've got are non-clinical. But we have deployed them out following some training and induction and infection control training in particular out onto the ward areas. And they're doing all sorts of things. They've been fabulous. So, you know, giving out teas, lunches, talking to patients, playing chess, on some of our elderly care wards, just to, you know, have some of that interaction with our patients who perhaps wouldn't get it because our nurses are so flat out. So they've been doing all, they came to do whatever we wanted them to do, and that's where we have deployed most of those, and it's the same at Northampton. So we're really grateful. They've been super, and they are here with us until the end of next weekend. So, and the reason why we were offered the support was because we had a number of staff that were out, and actually quite a lot of the East Midlands got the same kind of support.
Lovely, thank you very much. And can you tell me where they're from? Which regiment or whatever?
I can't, I'm afraid, Alison. I can try and find out for you, but I'm afraid I welcomed them and then let them get on with it. I didn't ask them where they were from, but we can find that out for you.
Thank you very much.
Thank you, Alison, for the questions. And yes, we'll find out that for you and come back to you. So thank you for that. Next up is Kate Cronin. Hello, Kate. How are you? Good afternoon.
Afternoon, Ian. Yeah, I'm great, thank you. I've got two questions, both about Corby. The first one is, how many tests has Corby Lateral Flow Test Centre carried out, or how many are you carrying out on a daily basis, whichever is easiest to answer, to be honest. How many tests as a percentage are positive, and is that having a knock-on effect on the very high positive PCR rates that we're currently seeing in Corby? Second question, why has there been such a difference between Corby's rates in the first lockdown, where the borough fared pretty well, and the rates in this subsequent lockdown? Seems to be a big gulf. We're not sure why.
Thank you very much for that question, Kate. I'll come to Lucy, who I know has been digging out those figures for you. I think she may have them. If she hasn't got them, then we will, of course, make sure that you get those subsequently. But I'll come to Lucy. Lucy.
Thank you, and hi, yeah, thank you for the question. So I do have some of the data, you'll be pleased to hear. So between the 20th of January and the 1st of February, Corby has undertaken 1,934 lateral flow device tests, with only 29 positives. So that's only just literally a smidgen under 1.5%. So it's not, you know, a high level of positivity. And it's not a significant concern, but the bit that it does provide is reassurance that those people that are having to go into work aren't taking COVID into a COVID secure area. So, you know, I think the value added there is brilliant, but, you know, lateral flow device tests serve a particular purpose in particular settings, and only if they are used correctly. If the other, you know, 98.5% of people who got a negative test then went and did things that sit outside of the current legislation or rules, they are abusing what these tests are for and are potentially contributing to some of our continued issues in Corby. So a good number of tests being undertaken. Good rate of bookings. We had a full booking this week. We did have some people not attend, and obviously again we would encourage people, the same as Chris has said, if you can't attend a booked test, in the same way if you can't attend a vaccination, please do try and let us know so we can utilise that slot for somebody else and make sure that time and resources aren't wasted. But it does not negate the fact that you need to continue to comply with all of the restrictions, all of the best practice, and certainly with all of the legislation. From a point of view of different rates at different points, you've got to remember that the rates earlier, very much before where community testing was obviously brought in. So one, you can't really compare the rates in areas from the first wave to the rates now. You can only compare from the point at which community testing, so the wider PCR testing, was brought in, which was kind of midsummer really. So one, it's difficult not to fall into that trap, but they are very, very different numbers that we would be comparing if we tried to do that. The other thing is, you've got to remember that Corby didn't fare that well, actually. It, along with Wellingborough and Northampton, were on the Chief Medical Officer's watch list at one point, and Corby did, again, at one point have the highest rates in the country, and worked very hard, came together, you know, had all the tests that we could possibly provide, did what they needed to do, and we got all three of those areas off the Chief Medical Officer's watch list. So it goes to show the power of the people. If people do stick together, if they do the right thing, and I know it's tough, and I know we're all fed up of having to do this, But fundamentally, if we don't, you will potentially see Corby being left behind, and everybody else will start to come out of restrictions. And with case rates as high as they are in Corby, that would not be the case, I am sure. So if we want to make sure that no one in Northamptonshire is left behind, as and when we get to a point where restrictions can be lifted, we've got to do what we did in the summer. We've got to pull together, and we've got to make sure that we identify every single case, get everybody isolated, and get that onward chain of infection broken.
Thank you very much, Lucy. Yes, couldn't agree more. Thank you for the question, those questions, Kate. I've got next Kevin Nichols from the Chronicle and Echo. Hi, Kevin.
Yeah, good afternoon, Councillor Morris. Thanks for coming to me. There was something mentioned at the Oversight and Engagement Board meeting yesterday that 80% of all the new cases in Northampton are now down to the new mutations. I just wanted to confirm these are the Kent variety rather than the South African or Brazilian ones at the moment still.
Thank you very much for that. I'll bring Lucy in on that one. Thank you, Lucy.
Yes, so you're right, that is the right narrative. You just got to, there's a little caveat in as much as not all of the tests undertaken anywhere are currently having all of the sort of genetic typing undertaken. It's too big a job, and it's extraordinarily costly. So a sample of the tests that are undertaken in one area get sent off, and nationally that's about 49%. So if we assume that we're roughly average, around 49% of the tests from the whole of Northamptonshire get sent off for that type of testing. And the percentage that then have what's called an S gene type failure, so that's a proxy test for the Kent mutation, it's coming back at around 80%. So it's within a sample, 80% of those are testing positive for, as you say, the Kent mutation. No other mutations at this point in time have been confirmed in Northamptonshire.
Thank you.
Thank you for that.
Kevin, did you have another question about care homes?
I did, but I don't want to hog the limelight, and please go through everybody else, and I'll put up my hand if there's time at the end. Thank you.
Thank you very much. Thank you. We come then to David Summers. David, hi, good afternoon.
Hi, how are you?
Well, thank you, sir. How are you?
Yeah, good, thank you. So this week is Children's Mental Health Week. So how concerned are you about the impact of lockdown and the ongoing restrictions on children's mental health? What do you think the impact will be in the short, medium and long term, and what's being done to address it in Northamptonshire?
Thank you. A very good question, and one which we all take an interest in. So I'm going to go to Paul Andrews first, who's from the school cell, and then I'll bring in Jonathan Nunn to just give a general overview on mental health generally, as well as with children. Paul.
Yeah, thank you, Councillor Morris. Thank you, David. Thank you very much for the question. It's a really important question. I'm glad someone raised it. So I'll just speak to what's been going on in schools. I think individually schools have been focusing on supporting their pupils. And I think that's been an ongoing thing. And I think many of them have, because it's Mental Health Awareness Week for children, have been doing events this week. In Northamptonshire as well, there's many organisations that have moved their services virtually. So schools have got access to these, and children and young people have got access to these. Additionally, the Healthy School Service run by Public Health Northamptonshire have been delivering for a period of time now virtual workshops focusing on the mental health, well-being and resilience of staff, children and young people. And I think that's been a really important piece of work. And that was funded with a grant from the DfE. And I think we're working with all partners to ensure ongoing support and mitigate the risk and impact of all of this. I think it's going to take a while for us to understand the depth of the issues and what we need to do, and I don't think we should rush into that, and I think there's probably others on this call better qualified to take this on any further. So I'll stop there and let some others come in.
Thank you, Paul, very much. I'm going to bring in Jonathan Nunn, because I know he's very concerned about mental health and awareness, particularly at this current time. Jonathan.
Yeah, thank you, Ian. Yeah, very glad to chip in on this one, really. The question asks how concerned, and I would say personally, I'm very concerned. I've always maintained from, if you like, not a health professional, but a novice view, that mental health is a foundation to everything. That's everything for individuals and everything for our town and every town, you know, in terms of economic success. And without good mental health, nothing else really matters. It can give you an absolute assurance, because it's a subject I've raised many times, that mental health and well-being, those issues and the risks to them are very much on the agenda for all the health partners involved. I know that for a fact, and we'll start to see more specific detail of initiatives coming forward. But I think you're right, David, to particularly raise children's mental health and how horribly unfair this whole virus has been, whether it's the younger adults in their late teens or going off to university who've missed those development opportunities, or perhaps even more importantly, younger children whose minds, characters, personalities and social awareness is being developed by interacting with people at school, and they've had that taken away from them. So I think long term there are potential significant impacts. We know that acute childhood experiences make a significant impact on the adults that we grow up to be. And this is going to make play a big part of that. It is an area it's important to me. I met earlier today with Dan Kane, who's the Chief Exec of the GP Alliance, along with David Smart, who is one of the directors of Northampton GP Alliance. I've worked with David on the Action for Happiness initiative, which is 10 Keys to Happier Living, which I think is a tremendous programme, and that's just one of many things that I know are going on. And we had the opportunity to discuss not just the pressures that are on people now who are already, as a consequence, suffering, their mental health is suffering, but actually some of these things come out post-trauma, if you like, if what we're experiencing, and it is a trauma, sometimes you see once you're through that trauma, the real impact hits you. Plus, we're going to come out to a lot of pressures, aren't we? We're going to see poverty problems, job problems, and all sorts of other things as well. So I think there will be both short, medium, and long-term effects. It's yet to be clear exactly what they are, but they will be significant. And I know that health partners are onto the provision of what can be done to try and address them. Thank you, Ian.
Thank you very much, Jonathan. Lucy, did you want to make any comment on that question?
I think only just really to reinforce what Jonathan's saying, it is a conversation that we have touched on as a group of chief execs, and I came in just simply I give an update on COVID, and one of the things that we touched on was the need as a system to make sure that we're planning not just the continued delivery of support services here and now, but also preparing, as Paul says and as Jonathan has raised, for what will be probably quite significant challenges in the medium and long term, from a point of view of all the way through the mental health sort of spectrum, from mild challenges on a day-to-day basis, having missed school, having missed social interactions, all the way through to probably some quite significant serious mental health illnesses that may have been triggered or exacerbated by COVID. It's one of the things that public health will obviously try and help identify and plan through needs assessments, which is part of our statutory responsibility. But certainly as a system and as a group of health and wider social care leaders, it's something that we're concerned about. It's definitely on our radar. And as we've talked about, we're happy to share plans as and when they get developed.
Thank you very much, Lucy, and thank you for the question, David. Certainly is going to be a priority going forward. I think we can safely say that the mental health of all our citizens, as well as the children, of course, who have been affected. Thank you for that question. So we now come to Alice Wilson and or Michael Pearson from Northants Live. Are either of you there? I'm not sure which, if it's both of you or one of you.
Hi, yeah, it's me. Thank you very much, Councillor Morris. A couple of mine have been answered, so that's great. But just to ask, a couple of interviews, particularly in the national media this week, have been claiming that schools could and should possibly open before March the 8th. Is that something that's shared by anybody on the panel? And also, regardless of whether they open then or not, should teachers not be moved up in the priority list for vaccinations if schools are going to reopen perhaps in a month's time? And also, just very quickly, I appreciate it's very early days, but you mentioned the 3 neighbourhoods in Wellingborough, which are the only 3 that have experienced increases in case rates. Is there any information about why those rises might have happened, and is there any indication that they will continue to do so?
Thank you very much for those questions, Alice. I will come first to Paul Andrews from the school cell to, if he can answer, although I know he's an oracle, but he's not necessarily an oracle on all things, whether schools will be open before March the 8th, and then maybe other comments from other panel members as well on that. But we'll start with that, and then we will go to possibly Chris to talk about the vaccination programme again with teachers, but we'll start with Paul. Paul.
Yeah, thank you, Councillor Morris. Thanks for the question, Alice. I think one thing I would want to get across now is that schools are open. You know, many of our schools, the teachers are in there, they're working extremely hard, both doing teaching in front of the children that are in school and remote learning. So I just want to quash the impression that schools are closed, because they're not. Most of them, or all of our schools, are open to some degree. Primary schools at the moment, they've got 23% of their pupils attending on average. So they very much aren't closed, and I think they'd want me to say that to you. Coming back to I guess your key point is the Prime Minister's said already that children and young people aren't going to return to full-time education or for everyone to be in school until the 8th of March. Clearly, central government have got a huge range of data that they look at, and I don't think it's for me or for anyone else necessarily, although everyone's free to do so, to second guess the decisions that are being made in central government. And certainly locally, we've always followed the guidance from central government and the DfE, and up until this point, that approach has served us really well. So I wouldn't, certainly my view is we'll do as we're asked, and we'll follow the guidance that we're given, because to date that's worked.
Thank you, Paul. I mean, it's just a date, isn't it? It's not, I mean, until infection rates and various other things are down sufficiently, it's probably slightly early to talk about such things in a sense anyway. But as you say, they're largely open anyway for lots of pupils already. So I'm just going to bring Chris in on there was a question in there about teachers and moving them up the vaccination cohorts, as it were. I know you've got an answer to that, so I'll come to you, Chris.
Thank you. So there are many professions making a case to move up the cohorts, and my answer is a simple one, which is we work in line with the JCVI cohorts, as does the rest of the country, and at the present time teachers are not a priority for the vaccine. Whether or not they should be is simply not an answer for me, I'm afraid to say. So at the present time, we are working with the cohorts that we have, and teachers remain out with that. What I would say is if they come in, and if indeed any other professions, such as my colleagues in the other blue light services, come in, then we will offer a service to them. But it's only when it changes nationally.
Thank you, Chris. And I don't doubt for a minute that we can more than adequately cope in the county with any change that does come along. So that's great news. So thank you for that. Thank you for those questions. Laura Coffey, you're up next. Good afternoon, Laura.
Afternoon, Councillor Morris. So just a couple of questions from me. The first one to Lucy Whiteman and Councillor Tom Beattie. Should everyone in Corby be tested for COVID-19? And secondly, I understand there was a meeting this morning focused on Corby. What's the plan going forward?
Thank you, Laura. I'll bring Lucy in, and it may be that she answered it so brilliantly that Tom doesn't necessarily need to answer the question, but we'll give her the option first. Lucy, over to you.
Thank you, and thanks for your questions, Laura. So yes, we did. Well, we meet every day. We have obviously situational report team meetings or incident meetings every day. So what we did have on top of that today was a very focused review of the Corby data in light of the fact that the recovery is so much slower than other areas, both in Northamptonshire, in the region and in the country. You know, we can't be clearer than I have been already. Our issue still is community transmission. So most of our actions are focused around making sure that people understand what the current restrictions and legislation are, that we're really getting through to those younger age groups where we've got the highest case rates, to make sure that, again, we're helping identify any barriers that they may be experiencing in either understanding what is required of them individually, or indeed if it's an issue around isolation and funding and that kind of thing, making sure that we obviously are able to provide assurance that support is available. And that's one of the things that we talked to our local MP Tom Purcell about, and he in fact joined for the second half of that meeting. So we've taken away actions, again, to make sure, as I said, every business knows their responsibility to report outbreaks, that individuals know their responsibility to obviously their immediate friends and family, but also to the wider community, making sure that people understand how to obviously do things like sharing childcare responsibly and as safely as possible. Because as I said, we do recognise that people can't stop everything. They can't cease all contact with others. So doing what they have to do, but within the legislation, within the restrictions, and obviously as safely as possible. We're looking at making sure that there's adequate funding for Corby Borough Council to support people who do need discretionary payments where they're not eligible for statutory sick pay, for etc. And to make sure that, again, we're pushing messages around the importance of testing, because until we identify people with COVID, get them to self-isolate and break that chain of infection, we'll see that continued transmission, particularly in the age group that's most affected in Corby, that younger age group. They will typically be asymptomatic. So, through no fault of their own, they will potentially be infecting other people because they don't have symptoms themselves. But we want to make sure that, any concerns they have about self-isolation and financial support or support with food and things like that are being addressed as well. So there's a set of actions that we've all taken away, both as public health, as Corby Borough Council representatives, and as I said, even Tom Purse-Club is helping us both with communication and also making sure that we have adequate funding to support people should they need it during that time. Some of the other things is just about making sure we've got access to data, so we know the numbers that go through our lateral flow device testing sites, but at the moment we also know that ethnicity data about where people work, etc., is being collected, and that's not yet flowing through nationally. So again, we're raising that to make sure that we've got as much information as possible about the position in Corby and elsewhere, so that as things change, we're able to act accordingly and in a timely fashion. So all good news. With regards to the question specifically about testing, and it's not that I disagree directly with Tom, of course, and it's one of the things that we touched on this morning in our meeting, but it has limited value for a whole community to be tested. And particularly if in actual fact, we're getting anecdotal reports that people are then using that negative test as, carte blanche to go and do what they want. That actually creates a bigger risk within that community. So, it is one of the things that is appropriate for people who have to attend work. The rest of the community have no reason to be mixing with other people and therefore should not need lateral flow testing because they don't need to know if they're at risk. The people who have to have communication and contact with other people because they have to work are the key target audience. They are being tested once a week or being encouraged to present to be tested once a week at this point in time. And then when larger organisations are able to provide that testing internally, we may well open it out to the wider community. But as I said, I cannot stress enough, if we find that people are abusing the negative tests or the testing processes that we put in place, we will remove them because they will only add value if used appropriately and if used by the cohorts that they are targeted at.
Thank you very much, Lucy, and thank you for that, Laura. Tom, I do feel Lucy answered that question very fully, but I wanted to give you the chance just to talk generally about the situation in Corby as you see it currently, if that's okay with you, Tom.
Yeah, absolutely. Thank you, Ian. I think Lucy has adequately answered that question in relation to the sort of mass testing part of that. What can seem on the face of it to be a good idea, often, the law of unintended consequences kicks in, and I think Lucy has identified that. I think Tom Purse-Glove's suggestion was made with the best of intentions, but clearly, I would listen to the experts on this about how they see that, and Lucy quite clearly is an expert. I wasn't at this morning's meeting, but Corby was represented, as it always is, Corby Borough Council. I was at another meeting of East Midlands Councils this morning where we also had a very long discussion about the state of the situation in the East Midlands regionally, and I was able to talk about Corby there also and express some of the concerns that I've raised here locally, particularly around workplaces. I also did an interview just an hour or so before this press conference with ITV Anglia, where I was asked, was I concerned about the Corby having one of the highest rates, as Lucy said earlier, the third highest in the country. And of course, I'm extremely worried, and particularly seeing that rise in over 60s, who are the most likely to become extremely ill. I think also there is evidence that household mixing is contributing to the high case rates in Corby. That includes gatherings indoors within household settings, multiple childcare bubbles, neither of which are permitted under the current rules. Car sharing also contributing to this. We've heard from the police earlier, from Elliot, that they'll be stepping up patrols in Corby over the weekend in the coming days, and will continue to take enforcement action against those who are breaching the legislation. What I would say is we really do need people to take responsibility, to mix only with their household support bubble or one designated avoid of the house, continue to socially distance, wash hands, wear face masks. Without doing this, and I think Lucy's already touched on this earlier, without doing this, our lockdown will go on longer in Corby than the rest of the country. So there's a risk that there could be further government intervention or restrictions in place for a longer time. We really want to avoid that. The last time we were placed on the government's watch list earlier, as has been referred to, we worked hard and we got ourselves off that. We need to do the same. We don't want to be in a position where Corby is being treated differently to the rest of the country. And unless we get on top of this and start to see significant decline, that's what will happen. And in terms of those businesses that are operating, I mean, there are very limited opportunities, I think, for local government to take enforcement action against businesses, particularly in respect of closing them down. I mean, there are some businesses which are prescribed by government which shouldn't be open in hospitality, pubs, etc., non-essential retail. Where we find that those businesses are operating, then we can do that. We can close that down because the government have given us the power to do that. But generally speaking, we don't have the power to just to close down workplaces or businesses. Only if the government was to prescribe what businesses should and shouldn't remain open. In very limited circumstances where there would be perhaps a major outbreak in one workplace resulting in some sort of major public health risk, then that's a different matter. There is things that public health can do about that. I mean, we had an example of that going back earlier in the year with the Green Corps outbreak in Northampton. So there are limited opportunities to do that. But I would say, to our local businesses, our environmental health officers are available for any workplaces or businesses that are not clear on the guidelines. They're here to help. Please reach out to them, reach out to us if you need any clarification. Look on the government website or just simply contact us and we'll give you the advice that you need to follow. Thank you.
Thank you very much, Tom. And thank you, Laura, for those questions. Very good ones, as always. I'm going to move to the last two, which are written questions from the Global Media Group, and I'll read them out. So this first one's to Elliot Foskett. Last week, you talked about the very high levels of fixed penalty notices being handed out. Which areas of Northampton are officers still dealing with the most numbers? Sorry, I lost my screen there for a second. Which areas of Northampton are officers still dealing with the most numbers of reported breaches? What are some of the most bizarre excuses that they are still hearing? Do apologise. I thought I'd been kicked off the call there for a second. Over to you, Elliot.
Thank you, Councillor Morris. Are you right? Okay. Well, I'm hoping you can hear me okay. As you'd expect, the bulk of the breaches come in the town areas because that's where we've got the most population. So that's where more people report. That's where more people are using the roads. So that's what we'll see. So it's no surprise, Northampton will see a higher proportion of breaches and a higher proportion of fixed penalty notices than say, Wellingborough, because there are more people living there. They are proportionate though. So the population and the amount of fixed penalties we give out, etc., remains kind of proportionate to the local population. Bizarre excuses. We've had the McDonald's one, which I think was widely reported. 5 people at 5 o'clock in the morning going for a McDonald's breakfast of all things was one. I think Tom touched on this, and I think Lucy has as well. The bubble, people saying these people are in my bubble because they think they can form a bubble of work or a bubble of mates and colleagues or whatever it is. They don't quite understand. The rules are really there for you to look at on the government website, and they're not that complicated. They're there around support. It's not there for you and your mates to form a bubble to go and do stuff. That's not what it's about. And I think I guess my most favorite excuse that I've heard so far is somebody saying they don't believe in COVID. So we went around their house, knocked on the door because we'd had a report of a breach of mixing of households, and the person said, yeah, well, you can't give me a ticket. I don't believe in COVID. They were sorely abused of that fact when they were handed a ticket. And you know what they think of that.
Thank you very much, Elliot. I think we lost the end of that slightly, but I think we got the message there. Yes, COVID denial is not an excuse for any breach of any rules. I think that's safe to say. So we've got one more, which is to Chris Pallow. We've got time just for this one, and then I think we'll have to wrap the meeting up because we're probably going to run over slightly. So we heard yesterday, that being Thursday, that another 39 mass vaccination centres are opening in England this week. Some areas include Essex and Bedford, who have multiple locations. Why does Northamptonshire only have Moulton Park? And are there plans for other locations? Chris.
Okay, thank you for the question. We've done admirably so far with our programme with the numbers of centres that we've already got in place. And what is a little different between ourselves and some other areas is that our model is centred on primary care. So we have 16 primary care hubs covering the entirety of the Northamptonshire population, which is supported by the vaccination centre as well. If future demand indicates we need to change our model, of course we will. And we are looking at bringing some community pharmacists on board, as you will have seen in the news in other areas as well. But at the moment, we're managing to deliver, as I've mentioned the figures already, I won't mention them again, good coverage to our population. We will keep an eye on that. At the moment, we're confident we have enough capacity to deliver the vaccines that we need to.
Thank you very much, Chris, as always, for that straightforward answer. And thank you to Global Media for those written questions, very good ones. I'm afraid I don't think we will have time for any further questions today, but I think everyone will agree that there's been some very good questions and answers during the session. So it remains for me just to say thank you everyone for coming today. Thank you for everyone who asked the questions and answered the questions. And see you next week, same time, same place for another press conference. Stay safe and well, and let's follow the guidance, and together we can beat COVID-19. Good afternoon.
Thank you very much.
Thank you, Ian. Thank you, everybody.
Thank you, everybody.